people have questions, I'm fine with this being informal. I am going to save plenty of time for questions at the end if you want to sort of hold them. But if there's something that really doesn't make sense, then certainly let me know and I'll be glad to slow down or back up the bus. Oops. So some of you saw, as I was speaking in the main room yesterday, but just to say that what I'm going to tell you about is also for the families and it's also for the researchers. We have many researchers in the room, and for the researchers, any of the data that I'm talking about today is all de-identified but freely available, and certainly grab me afterwards if there's anything I can do to help your research. There's a huge team behind all of this. You're seeing many of them here, and many of them are actually back home still working. But just to acknowledge, there's a huge team that we put in terms of powering all of this support for you guys. And as we're doing it, we do want to hear from you. So it's your chance, whether you're here in person, grab us at any of the either times, the breaks, the meals. But we do want to hear either what's going well, but also if there are gaps in terms of other things that you think are important, questions or issues. We're here to work for you, basically. So tell us in terms of what can be helpful. Researchers for you, the same as we go through and do this. So as we're doing this, I'll just say we continue to evolve. Jennifer mentioned it, but we've been at this for 12 years, which is always sort of amazing to me because it feels like 12 months. But as we've been doing this, we realize that there are new opportunities. There are both new technologies, new ways to support our young people. And as we're doing it, we need to, in some cases, be able to be flexible, nimble, and be able to be creative. So do let us know that. And then for the researchers, there's some new technologies that are coming online about things that you can or want to do as we're understanding the condition more. So do let us know in terms of what will power your research. As we're doing this, our goal is the same as Haley's goals, which is we want to improve and enrich lives to make people be the best version of themselves and be able to just be happy, be able to be joyful. And so things that we can do to help that, let us know. We are putting out reports periodically, and we're trying to gear this exactly to families of a lay audience so that you don't have to be a scientist, you don't have to be in healthcare to understand it, as well as meetings like this that we're intentionally recording because we know everyone can't be here, and we know people will be diagnosed literally tomorrow or next week, and we want them to be able to instantaneously access those resources, not have to wait a year to find someone else who has the condition. Certainly, like I said, let us know in terms of whether or not this is helpful or additional information that you'd like to see. Many of you have been incredibly generous in upstairs being able to donate a blood sample. I'll say that for this community in particular, that's been incredibly important. Again, we de-identify all of the samples, but we're making them into cells that researcher can make into brain cells. We call these induced pluripotential stem cells that are then made into brain cells because we don't want to do brain biopsies, but we do want to study the brain and we want to study particular differences. I'll get into just a little bit of the nuance, but it ends up being very expensive. I will say that, but we're footing the bill, so you guys don't have to worry about that, but being able to make it scalable and distributable to other folks. So researchers, again, let us know if this can be helpful to you, but as we're doing this, it's a resource that will be enduring. Okay, so let me get down to business. With all of this, I'm going to say something very technical, and if it doesn't make sense, don't worry about it. But there are some researchers and some folks that'll understand that SETBP1 is a little bit complicated in terms of the different genetic variants that we see within the gene. And so with this, I'm focusing today on, I think, everything that's applicable to this community in terms of being SETBP1, what we call haploinsufficiency disorder. Okay, and so what that means is, in this particular case, most people have 2 copies of the SETBP1 gene that are working equally and working fully. But for this community, instead of having 2 copies, it's if there's only 1 copy. Okay, and so in that particular case, there are different genetic variants that can all lead to functionally the same equivalent, which is having half the amount of the protein that's working. Okay, so the reason I say this is because there are other individuals with Shinsell-Gideon syndrome who have a different type of genetic variant. And there are some things that are shared, but there's some things that are different. And I know it gets very confusing for your doctors, I will say, your doctors who are not really sophisticated, no offense, but many of them don't understand the difference. And so they may try and lead you off in this direction and tell you about this, but you really want to be over here. So do tell them, pay attention. We're using the nomenclature haploinsufficiency. haplo, meaning half, and being only having half the amount. Okay, so I know that was probably a little bit confusing, but if there are any questions when you're going to your doctor, just tell them, make sure you're reading the right information. And if you're reading about or looking up Shinsel-Gideon syndrome, you're probably in the wrong area. Now, I will say that there are certain individuals who are relatively new coming to the community where we're not completely sure which community they belong in. So I will say this continues to evolve our understanding, and for the researchers, this is a priority for me to understand, is this, what's the same and what's different, and how can we get to exactly the information that people need to use for this. Okay, within this, what I've laid out here, and some people saw the same slide yesterday, is that within the research, there are many, many steps that go to this. But the first very important step is to get a copy of your genetic test report, because that allows us to say, do you belong over here? Do you belong over here? Or are you in the middle where we're still figuring things out? And that is very important to the researchers in terms of how they categorize things. So I know it's a pain in the rear end, but that's why we do it. And it's really important that we do that. After that, we've been doing things in terms of talking with a genetic counselor on the phone. I hope this is a conversation reciprocally where you can learn more and they can gather information from you, and maybe it's not quite so onerous. We've worked really hard to have internationally, literally almost all time zones that are reasonable covered. So we have people around the world, genetic counselors around the world, working with you for that in multiple languages. And then after that step, being able to do surveys online, and increasingly we're bringing more and more languages online to make sure we don't leave anyone behind. And then, as I said, and some of you are doing it here, in-person assessments, blood samples, and we have a program called Research Match where researchers can be able to find individuals, and then you can decide whether you want to participate in their research. But all of this hopefully to generate data that's helpful. Just very quickly, I think I mentioned this, but for the researchers, there are libraries of induced pluripotential stem cells, and we'll continue to expand that over time. And for anyone who's interested, you can grab me. But again, this is mostly for the researchers in terms of what specific genetic variants are available to be able to study. And literally the only thing that's charged is the cost of shipping you the sample. So it's very, very easy to be able to get this. Okay, this is the gobbledygook that I explained, and don't worry about the details of this, but again, mostly for the researchers, all of these genetic variations we think act in this way, where you have half the amount of the protein, and increasingly there's some new, what we call missense, or very small changes in genes that we're getting to understand better over time. And I won't go into deeply about that, but to say that there may be particular locations within the gene where those cluster, and those may be very important to understand the function of that gene. And I'm not going to go into lots of detail in the interest of time here. One of the things I wanted to celebrate, because I do think it's really important for us to realize this, is that high level, our children are generally healthy. This is really good news, and we've been seeing that over time, and they're generally happy. There are some issues. I'm not saying that there's nothing for us to work on, but they are generally just, and I can't say it just comes across obviously so much when we get to meet everyone here and see them playing and hugging and smiling. They are wonderful individuals. And so within this, that's why I emphasize here. And again, I do want to emphasize the numbers are somewhat modest. This one survey is based on 13 individuals, but they are in good health, 100% of these 13 folks. So that's great. Within that, they are generally smiley, laughing, giggling. That's the good thing, is that they are living life, right? And they are joyful individuals, and they are, I just can't say, in some ways, just joyful, and I can't tell you, their spirits just exude warmth. I mean, that's the thing that I want to get across. Within this, though, there are a few things that are important, and I'm going to spend some time talking about that, because that's where we want to be able to make improvements. Within doing this, sleep is generally good for most people, but there are individuals for whom sleep is an issue. And I know when sleep is an issue, other things downstream are an issue for that, right? And so that's one of the things that we want to work on. And they do enjoy lots of different things, but I will say they enjoy things that they can predict, and things that are unexpected can be difficult sometimes and challenging. So those are some of the things that we want to be able to work on going forward. In terms of being able to, work with others and being included in activities. And again, very good in terms of family, friends, schoolmates, things like that. And in terms of being able to express their needs, some gaps. Again, I think we're doing well in terms of better technologies to be able to do that, but there's still some gaps. And I know frustrations when they can't be able to express their needs or their issues going on. Okay. So now I'm going to delve for a second into the medical issues. And again, high level is that for the most part, there aren't significant medical issues. Then again, on the numbers, this is based on 19 individuals. Okay. So first issue, and I can't tell you how excited I am to see some of our older individuals. So this is the age along the x-axis here, and this is the number of people we have at any one age. The main point that I want you to see is that most of the individuals who at least are represented in this research are under the age of 20. Okay, so I think we're getting a better picture of what it's like to be a child with this. I think the question many of you are asking, and many of you are generous enough who have older children to help us understand, is what is it like to be an adult, right? And so I think in terms of what we need to watch and be mindful of, potentially prevent or be able to monitor, we're looking a lot to the older generation. And we thank you for being so generous and helping the community understand this, because it's based on small numbers. Now, that's not to say there aren't more adults out there with the condition, right? They're out there. They don't know it. They don't know what their diagnosis is. And if there's anyone who has advice for us about how to make sure there's more access to the genetic testing that helps get the diagnosis, certainly pull me aside and tell me. But I just want to say the limitation of what I'm talking to you about is mostly what I would call a childhood experience of this condition so far. Okay, we're committed to be able to understand this over the life course, but we're limited right now in terms of our understanding. Okay, so as we're, So as we're doing this, I'm starting out in terms of basically what I call above the shoulders. Sorry, this is slow. Okay, so when I'm talking, most of the manifestations that we see to me are basically in the brain. So this is basically mostly a brain and behavior condition as we think about it. And so as we're seeing this, this won't come as any surprise, but largely what we're seeing initially are problems in terms of language. And we were hearing a lot yesterday in different breakout sessions or the fireside chat. I want to make sure, I think everyone here understands, but I'm saying this for providers if they might be listening to this on video. Understanding or comprehension far exceeds ability to express, especially when we think about verbal language. And so do not sell these individuals short, right? These young people actually can process and understand quite a bit of information. I think it's up to us to find technical means for them to be able to express themselves, whether it's literally learning to speak or other ways to be able to get their thoughts across. But we do see as a major issue the language impairment. Again, I'm talking really about verbal language, speaking language impairment. I know they know a lot more than that. It's not surprised, but they're delayed in terms of their developments, and I'm going to get to that later on. And we definitely see some issues in terms of autism, anxiety, or problems with attention. Let me just show you how to read the graphs, and I know the numbers are small, but we'll be able to post these later. The number is the first one, the number out of 19, and then the percentage of those individuals in parentheses, okay? And so again, these will be posted afterwards for any of your doctors or therapists who might need this or yourselves. The good thing to me is that, and again, our community is still young, who's represented here, but within this, we're not there. What is it we're not seeing? And I think that's good in terms of being able to see other scary diagnoses. Okay, so other things that we're seeing in terms of neurological issues, we are seeing issues with muscle tone. We are seeing issues with muscle tone, and muscle tone being low is very, very common. And this is leading to some problems, and obviously why we do physical therapy, why we help in terms of core strength, being able to strengthen the core. We also see problems with coordination. So our young people may have problems in terms of being able to, whether it's fine motor movements with their hands, or whether it's things like running, jumping, going up and down stairs. Not surprising that some of those are issues. Within those are really the main issues I want to focus on. Onesie, twosie sorts of things are high muscle tone or cerebral palsy, not common is the point that I want to make. Something like a tic disorder, again, not common in terms of what we're seeing here. So it's mainly the things that I think you already know about. Again, I'm saying not surprises. I don't want you to be worried that there are other things coming down the road that we see so far. Vision is important. And the reason I say this is because literally the vision is how individuals are seeing and experiencing the world. And so if they're not seeing clearly, it makes it that much harder for them to learn and to navigate and to keep themselves safe. And so for those of you, hopefully everyone has seen a pediatric ophthalmologist or an eye doctor. If anyone that's listening hasn't, you should. I'm not saying there will be a problem, but if there is a problem, it's a treatable problem. And we don't want to miss those things that can be treated. And within these things that can be treated, oftentimes one that we're seeing is farsighted. And so this is something that's relatively easy to fix. I will emphasize a pediatric ophthalmologist for children with special needs is really important, because in terms of this, your kids are not going to be reading the eye charts and being able to say A, B, C, D. So you need to have someone who's able to actually both do a proper exam as well as be able to have them cooperate with you. But again, for the most part, these are things that for the most part are treated with glasses or corrective lenses. Rarely, there may be surgery that's necessary or patching, but again, these things are all treatable in one way or another, and it helps them just to be able to experience the world clearly. The medical issues are relatively, I would say, minimal. I don't want to, sort of dismiss them, because the GI or tummy trouble, I call it, is not a joke, right? And I know when you're having problems in terms of that, it can sort of overwhelm behaviors and it can make for things being very uncomfortable. But these are things that with a good pediatric gastroenterologist, figuring out just the right diet, figuring out just the right medication that may help with either reflux or sort of heartburn or constipation. Once you get to a good place with those things, you can oftentimes stay on a much better course. So helpful in terms of being able to do that. There's not a magic wand, I will tell you. It's not like there's one single magic medication that's just going to make your life all better. And it will require some trial and error in terms of doing that. Other than that, though, there are really not so many other medical issues. What I'm saying here in terms of endocrinological issues are often problems with growth that individuals may not be. If your family is a family of 6 feet tall people, don't expect your child to be a 6 foot tall person. In general, they tend to be shorter. And one of the things I would like us to strive for as we think of standards of care is having a growth chart that's specific for SETBP1. So we can actually be able to say, not for your pediatrician to plot your children on the same growth chart as everyone else and saying they're not at the 50th percentile, I wonder what's going on. Be able to say, oh, well, for SETBP1, they're exactly where we expect. And don't worry, you're doing everything just fine. So with time, I know we'll be able to get to that. For some of the young men, there have been problems with undescended testicles. In terms of immediate medical concern, it's not immediate, but there's a very simple surgery. We can tack down the testicles, which will minimize any future risk of testicular cancer. And so it's important for your pediatrician, they're the first line of defense, to see that and to see if it's an issue and needs to be treated. Otherwise, the other things you'll see here are literally onesies. So we have very few individuals. I will highlight, though, that scoliosis is one of the things I think we need to keep an eye on, because that tends to come up during puberty when children are growing quickly, where the spine may become curved. And we don't have as many individuals who are yet in that pubertal period. So that number may go up as we think about the life course for these issues. Okay, we've listed here the medications that people are using because in terms of medicines, these are significant enough to be problematic to require treatment, medical treatment. Attention issues, I'll point out here, epilepsy important here, and sleep especially. And so thinking about those medications can be helpful. Again, I don't think there's one single medication that's helpful. It is a little bit of trial and error, but I will say in terms of attention issues, don't be afraid to use medication. I think sometimes parents are a little bit worried, but don't be afraid to do that. It can be extremely helpful in terms of educational impact. Okay, I'm going to go very quickly through this, but this is now something that many families have been kind enough to fill out what we call a developmental assessment. So these are your reports in terms of how your kiddos are doing. And the way that all of these are done is to look at age, again, along the x-axis. And normally children should be developing. They should be gaining skills over time. And so there should be kind of a developmental growth chart. And what we've done is, and I'll give credit to those in the back, Libby Brooks and Leanne Schneider, our psychologists, have plotted this out and shown us for the group, what does it look like on average the kids are developing in terms of doing. So the good news is that children are developing over time. They're gaining skills over time. They're not losing those skills once they really have them, but sometimes it takes a while to really get them solid. But the point is, this is not a regressive condition. It's not like the kids start going downhill when they hit 25. It's not like Alzheimer's. So it's mainly a matter of being able to go up and gain those skills. They're certainly slower in terms of gaining those skills. And I think what we as researchers are trying to figure out is how do we pivot that curve, right? How do we be able to move that so that we can have them gain more skills faster? So in terms of doing that, we divide these up into some very practical things about what your children, what you can expect. And so if you've got a 3, 4, or 5-year-olds and you're sitting here at this conference saying, I wonder what they're going to be like at the age of 20. What do I need to plan for? This is if we had just current state. And I want to emphasize that between where your children are now and when they get to the age of 20, for an example, I hope we will have more things to be able to help them be able to achieve more. But they are making nice progress. I think we're trying to focus on things that matter. So things that help in terms of independence, satisfaction, self-care, trying to pick those things in terms of things that are important. And so they are gaining those skills like being able to do some things independently over time. From a social dimension, this is another thing on this particular instrument that we can see. And again, they are gaining skills in terms of being able to interact with others, being able to be safe, stranger danger and things like that take a little bit more in terms of being able to teach those, but being able to interact with others, which I think is a really important developmental skill, is certainly making progress over time. As we're doing this, this is what I was saying in terms of being able to do things like hop, skip, jump, run. Again, things are coming in over time, but they're taking a bit longer in terms of how to do that. And safety is a big issue as they're doing this. Okay. One of the last things I'll talk about are we're looking for any things that might be problems. So diagnoses in terms of behavioral problems, and the news here is good. So I want to emphasize the news that we're not coming with things of concern. This is broken down into 2 different age groups. The first age group is the little ones, so those that are 1.5 years to 5, and there are 11 individuals represented here. And for there to be a concern, you would need to be in this zone over here of significant concern. And you can see across all these different areas, there's nothing that's of significant concern. All of these are in the range of basically, this is what we can see in normal individuals, normal children. So there's nothing that we're seeing in terms of anything, even though you might be seeing a little bit more in terms of oppositional behavior, nothing is coming into the range of concern here. So that's good news. When we get to those a little bit older, so age 6 to 18, again, 12 individuals here, no one in the range of significant concern here. And in particular, we've been looking very carefully at adolescents, because sometimes adolescents, for those of you who have had normal children in adolescence, I have to say that's its own thing in and of itself, just regular adolescence. And so kids go through their own developmental stages there. That is one thing we're watching very closely with the SETBP1 haploinsufficiency community to see if there are things that come up. We're not seeing anything yet, but as I said, we're just starting to get folks moving into that age range. And so we'll see over time. With this, again, I take this as reassuring. It is still based on somewhat small numbers. So if we can get better numbers to know for sure that this is the case, it'll help us as we try and come up with clinical care guidelines over time. So the types of things, though, that we did see, if you look at the individual things that parents were reporting, again, this is within the younger folks up till age 5. There are some difficulties in transition, moving from one activity to the other. There are some problems in terms of attention, focus, hyperactivity. I think we knew about that. And there is just, sort of the getting into trouble, getting into things. But, I have to say that's not unlike other kids this age. So that doesn't worry me too terribly much. In terms of the older age, again, the things that I think we're seeing are problems in terms of distractibility, focus, and to the extent that it impacts the educational experience, impulsiveness, and doing things like over and over, some obsessions that we're seeing. And so helping with that, I think will help in terms of quality of life. So at the end of the day, I want to focus in terms of the positives. You're not seeing a lot of medical issues here. And I think that's a really, really good thing and an important thing. We're not seeing things like intractable seizures or epilepsy or kids that are dying or kids that are having, bad things in terms of diabetes risk or heart risk or things like that. So that's the really good news. Now we know where we need to focus our attention. We do need to focus our attention in terms of helping kiddos stay focused and develop some more of those cognitive and language skills and communication skills. And for some individuals, we're still having a certain significant portion with autism. Sometimes people tell me it's the SETBP1 type of autism, though. It's a different type of autism sometimes than your providers might be used to. And so it's important for them to know about that as well. Okay. So with that, I'm going to pause, and then we've got some time for questions. I didn't see questions as I was going on, so we've got time for questions now. And if there are things that weren't in the presentation, though, that we may need to, we've got, believe it or not, a whole team of data scientists in the back on the fly to be able to answer questions if we have to look them up from the registry. So let me pause here and see if there are questions. Or suggestions. I'm also happy to take suggestions for what you didn't see up here that you're curious about.
I think one of the things that I'm curious about, and maybe
Okay, you got the mic. That's okay. Thank you.
Yeah, I'm curious. I'm Mike Noonan. One of the things I'm curious about, and maybe going forward in further research is, you know, maybe as you're polling and having families or people fill these surveys out, you know, talk about different therapies that, and how many times a week they're doing the therapies, so you can see if, you know, there's anything statistically significant that says, okay, somebody's going to therapy X days a week, you know, where it helps with different maybe language or behavioral or occupational, you know, different things like that. I think that would be interesting to have, especially since the subset and sample size is so small.
Great suggestion. So I'm going to picking up some of the other things I've heard at the meeting. I think that's a great suggestion. And I think if as we include that, we'll include some maybe non-traditional therapies as well to see if any of those are working. And then, although Dr. Green Schneider is going to shoot me for this one, one of the things I'm going to ask is that more than just a yes, no, or how frequent, if you can give us some richness in terms of why you think something, or sort of insight that you have that might be beyond the yes, no sorts of things. And that would be helpful to know. And then I'm also going to make it really complicated, which is that one hypothesis I have is that starting these earlier is better. And so knowing not just what you're doing exactly right now, but historically maybe what you've done. So great suggestion.
Just similarly, it'd be good to know what medications are working, especially for the ADHD, that distractibility component, impulsivity. That would help to know if there's kind of a consistent approach to medication that would help.
Absolutely. So we have been asking that. It's something that we haven't seen a clear winner yet in terms of just, you know, like Ritalin is clearly working for everyone in terms of this, but that is something we're definitely keeping track of.
Hi. For the older group, I just want to say that we've seen behavior issues all our son's life. And we've been on every medication from A to Z, and medications is definitely would be wonderful, you know, if you can find something that worked. But so far, we've not quite hit that area yet. So, you know, when you're saying that you're seeing it really mild, we've seen it just the opposite.
Yeah. I don't mean to put you on the spot, and, you know, no need to.
That's fine.
So can you give us a little bit more, because the group here has mostly younger children, and I know you've been living with this a long time. Can you help us understand in terms of what have been most impactful? And if there was something that you could treat, what behaviors would be most impactful to treat?
Well, he's definitely got the aggression. I don't know. Some of it I've always thought over the years, maybe it's the communication. He can't get his point across. As he's gotten older, I've found that he seems to know good behavior, but he also knows with bad behavior, he can get his point across. Like if he was ever in a day program, if he didn't want to be there, he'd start throwing tables, chairs, everything else. He's just, he wanted out. And, you know, there's nothing that we can give them. We've had behavior people in there working with them, and we have a lot of problems, not just with not the behavior people, but the people in like the group working with him. They're reluctant to try some of these options. So right now he has no place to go. We can't get him in a group home. We can't get him into a day program. And, you know, but he's always had this aggression. I mean, we've got holes in the walls. I could go on forever. He's been in the hospital for it. Now, I have to say, the last couple of years, he's probably been home with us more because of COVID. He's not quite as aggressive. A lot of you, I'm sure, have been hugged by Joe this week. But it's still, if it has to be directed towards him. If everything's going fine towards him, he's fine. But if you start talking anything negatively or not about him, or another person acts up, he's following right in their footsteps.
And with this, has there been any medication that's helped, do you think?
The one that we've had in more recent years that seemed to help a little bit has been clozapine, or sometimes known as clozaril. But otherwise, the vast majority of them have not been helpful. The comment I wanted to make is we have often asked the physician, is there a medication that we can have at least for emergencies when he's having a really, really bad day, or we're out in a social situation where we really need to calm him down before they drag him off to the police station. And the physicians are very reluctant to give us anything. They'll say, oh, well, there's this or that, but I'm not allowed to give it to you because it can only be administered by a nurse or a doctor or something. Whereas in the past, they might give us a certain tablet of something. And I think a lot of that has to do with whatever the government regulations are in a particular community or the federal.
And in those circumstances, could you give him a pill or something by mouth, or would he not be able to take him?
Yes, we just don't have.
Yeah.
We had something once upon a time, and was able to give it to me, and we thought calming down and long enough for us to be moving from the situation. And now we get done. So if we're out of a certain situation, or at home for that matter, and he's having a really, really bad day, we just have to suffer through and get more holes in the walls.
So I was thinking just for time with, I was thinking for time, maybe after.
Yeah, we can talk later.
Yeah, I want to connect on that. We're gonna take one more question and then we're moving on.
Hello, just it's kind of tiresome. Just from our point of view, we don't have in Puerto Rico, we don't have any pediatrician that can handle him. That does start. Okay. And his let's see how to put it. His grade level for educational grade level is like the same as my daughter, he needs to learn the numbers 1 to 10 every day. His brain is like have all this information, but do not retain it. So he learns for 6 months, everything that the grade goes. However, let's go to the summer, 2 months. And when it starts in August, the next semester is like, we need to start over again. He takes therapy every day. He have speech therapy 3 times a week, automotor therapy 2 times a week for 45 minutes. That's every week. And it's like we change him from providers 2 or 3 times because it's like you fill this hole, it's a black hole. You can give all this information, but he doesn't retain anything. He doesn't have any variants. Like I was talking with another parents over here, but his result only says SETBP1. He only have epilepsy because he was treated from 6 months old until last 2 years ago for fever seizures. So he now have Kebra and he have vaccine so he can able to sleep. And then he has risperidone. And that's the package from and also melatonin. That's the package from before to sleep. On the mornings, he have the same thing without the vaccine, but he needs to have the risperidone. Otherwise, he's going to be jumping all around this. So it's kind of hard to do this. We tried gastros, we tried everything. We tried is also ENT because he have a lot of infections, ear infections, throat infections. He just have to remove his adenoids. And it's kind of this old thing, they try to treat him like for every symptom, but we don't have, like, for example, something that treats the condition. We need to say that, to tell them that he have this condition that provoke all those conditions so they can know how to handle.
So let me just try and generalize this for the rest of the group is that, number one, you do need to be treated as a whole person. And there are things, for instance, with treatment of epilepsy that then affect education and ability to learn and interactions with therapists. And so this is, Haley was pointing out that we are trying to, as a community, develop some centers of excellence that will think about that and take the experience of that. And I think those are going to be incredibly helpful. I'll also say that we have a couple child neurologists here at the meeting, Dr. Sid, Jennifer Bain, that if there's some very specific questions that you have, sideline them. And they do have a little bit of time for one-on-ones, but don't give up. So in terms of those therapies, although it feels like it's just a sieve and it's going right through, do not give up in terms of those. There are some things.
No, we are not giving a sleep, we go up. However, he's going to start the 4th grade, but he doesn't know how to read. He also does not know how to write his name. He have problems doing these movements. So we are using the communicator, but this could provide one who is more delayed. So we're going to try to use the iPad process. However, is that when since they all have a little big kids, they wanted to know how they're going to deal with this. I started school, which is they're gonna to notice that, okay, my kid doesn't do this, although he has the condition, but they need to know that in some cases, you're going to start repeating the same thing that they have on classroom. You need to do it at home every day.
Thank you. I was going to say, Dr. Sid will be a good one to connect with. Okay, so we are going to thank you so much, Dr. Chung, for your wonderful presentation. And next up,